If you've been on the fence about getting the COVID vaccine, now is the time to make a decision and get vaccinated. We have a licensed vaccine, and we have a great deal of safety and effectiveness data. We know that COVID vaccines will protect you from serious illness and death, including illness caused by the COVID-19 Delta variant that is a huge problem in the United States. People who are unvaccinated have a 17-fold increased likelihood of being hospitalized with COVID compared to people who are vaccinated, and people who are unvaccinated are more likely to transmit it to others. The Delta variant is more contagious and more severe than previous strains of COVID-19, and so it's really important now at this time for people to get vaccinated. It's important to understand that breakthrough infections will occur because no vaccine is 100% effective. And so we expect to see some people who are vaccinated develop infection. But the key here is that these are much milder infections. People are not severely ill. Vast majority of them are not hospitalized unless they're immunocompromised or very old. And they're less likely to spread the virus to other people. They're shedding less virus for shorter periods of time if they're vaccinated. And overall, your likelihood of getting infected is greatly reduced if you're vaccinated versus unvaccinated. So it's not a surprise that we see some people become infected if they're vaccinated, but that doesn't negate the huge benefit of the vaccine in terms of preventing serious illness and also preventing and reducing the risk of transmission. It's very helpful to get the vaccine even if you have been previously infected with the COVID-19 virus. And there are a couple lines of evidence that lead us to that conclusion. One is that if you vaccinate people who have been previously infected, you get a strong boost in their antibody levels, far above the level they had from the infection itself. And we also know from a variety of studies that the higher your antibody level, the higher your level of protection. The other important aspect of that is if you start with a higher antibody level, it's going to take longer for it to decline. And so while it is normal for antibodies to go down over time, that's how vaccines work, that's how the immune system works. But if you start at a higher level, you'll have higher protection and it will last longer. So based on the immune response, it looks like there's a substantial benefit to vaccinating people who are previously infected. In fact, the first dose of vaccine is like the booster. The infection was the priming dose, and the vaccine is the booster dose. Sure, did the FDA move too quick? Yes, people have had that concern, especially because the vaccines were initially available under something called emergency use authorization, which is short of being licensed. And that was in order to shorten the time frame to make sure the vaccines are available. But the standards were not compromised in terms of safety and efficacy for emergency authorization. The only difference was that the follow-up time was shorter. It was 2 months instead of typically 6 months. Now that the Pfizer vaccine is licensed, we have 6 months of safety data for Pfizer vaccine recipients from the clinical trial. So the emergency use authorization was important in a public health emergency to make sure the vaccine was available, but there was no compromise of standards. The other thing that I think is very important for people to understand is separate from the regulatory agency, there's an independent review process, both at the FDA and at CDC, by independent experts who review the data and make a recommendation to the FDA and to CDC about whether the vaccine should be authorized and, in fact, recommended for use and who should get it. That process is transparent. Those meetings are held in public. You can read the materials online. You can watch the meetings online. And the advisory groups to the FDA and to the CDC have been unanimous in terms of their agreement that the vaccines are safe and effective and that the benefits greatly outweigh the risks. These are definitely not experimental vaccines, and now that we've given more than 350 million doses in the U.S., we know a great deal about the safety profile of these vaccines, and it is very reassuring. Myocarditis actually is a good example of our vaccine safety system working well. Reports of myocarditis first occurred in the reporting system called VAERS, where physicians and the public can report adverse events after vaccination. But VAERS reports in and of themselves don't prove that something actually was caused by the vaccine. So further studies were done for myocarditis to determine whether or not people who are vaccinated really do have an increased risk of myocarditis, which is inflammation of the heart. And the answer is yes, they do. And we know that from the Vaccine Safety Data Link, which Marshfield Clinic participates in, as well as from other studies. But there are a few sort of key points to keep in mind regarding myocarditis. One is that the overall risk is very low. It's very rare. In the VSD, it occurs around 5 to 10 cases per million doses of an mRNA vaccine. So that's a very, very rare occurrence. The other thing to keep in mind is that cases of myocarditis have been mild in general. People have presented with chest pain within a few days after vaccination, but then they recover very quickly, and there's no sign that they're developing any severe or long-term consequences from that episode. But it is real. So because it's a real risk, it's important to do a risk-benefit analysis. And that has been done by independent advisory groups to the CDC, or the CDC advisory panel. And what they concluded is that the benefits of vaccination strongly outweigh the risks of myocarditis. And let me give an example just to highlight the difference there. If you vaccinate 1 million people, 1 million young men, 18 to 24 years old, that might cause approximately 39 cases of myocarditis. That's the risk. The benefit is that that will prevent 1,000 hospitalizations due to COVID-19 and over 230 ICU admissions of severe life-threatening COVID-19 in that same population. So again, we have to balance the benefits and the risks. And across the board, in whatever age group and gender you look at, the benefits greatly outweigh the risks. So we're not denying the risks. It's important that people understand that there is a risk of myocarditis, but it's important to keep it in perspective. People need to know about it, but understand the risk of dying from COVID-19 or winding up in an ICU is far greater than the risk from myocarditis. There have been no deaths that have been confirmed to be attributable to the vaccine. There are a number of monitoring systems in the United States that are tracking serious problems and deaths related to the vaccine. One of them is called the Vaccine Adverse Event Reporting System, or VAERS for short. And that's a voluntary reporting system that the public and doctors can report to. Information from VAERS has been misinterpreted in social media to suggest that people are dying from the vaccine, when in fact that's not true. People report to VAERS all sorts of things that happen after vaccination, but that doesn't prove that the vaccine actually caused that event. And lots of things happen by chance. The purpose of VAERS is to really provide an early warning system that then can be followed up, and studies can be done in more reliable systems to determine if there's a true relationship between vaccine and some outcome that we're concerned about. So VAERS is useful in that sense, but VAERS data alone does not prove that a vaccine caused any particular problem, including a death. I think many people are not aware of the scope and rigor of the evaluations that are done to make sure these vaccines are both safe and effective. That includes both the studies that have to be done before authorization or licensure, where they look at the data from randomized clinical trials, and they assess both safety and efficacy and immune response in thousands of people. But then even after the vaccines are used, there are a number of monitoring systems in place in the US and in other parts of the world to ensure that there aren't any hidden safety concerns that weren't detected in the clinical trials, and to confirm that the vaccines are working as intended to prevent both symptomatic infections and serious illness due to COVID-19. For example, one is called the Vaccine Safety Data Link. We've been involved in that for 20 years here in Marshfield. That's a national network of sites that use data from electronic health records to look at vaccine safety concerns. The Vaccine Safety Data Link is monitoring the safety of COVID vaccines in real time. Every week we run analyses. We look at around 20 or so different possible health effects that either they're health effects that occur after actual COVID infection, or they're something that has been seen with other vaccines, and we want to see if it's a concern or a risk with the COVID-19 vaccine. So we're monitoring these in real time. There are other safety systems that are monitoring safety in pregnancy, safety in other circumstances. And we've given out over 350 million doses in the US at this point in time. And we have a very high degree of confidence that these vaccines are very safe, and multiple studies have confirmed that they are very effective. We've been doing vaccine safety and effectiveness research for over 15 years now, and we've learned a lot, both on how vaccines are evaluated before licensure, but our particular focus is continuing to evaluate the safety of vaccines after licensure. So we're part of a national network that has investigators from all over the country, including the CDC in Atlanta. And we are doing vaccine safety research on COVID-19, looking weekly at the number of expected adverse events after vaccination to see if the number of events that are actually occurring in our population are more than what we would expect by chance. So that work is ongoing. We're also involved in looking at risk factors for COVID-19 and the occurrence of COVID-19 in a rural community, that is Marshfield. And that's a CDC-funded study that is led by my colleague, Hong McLean. That study is ongoing, and we're going to learn a lot about COVID-19 transmission and hopefully vaccine effectiveness from that study as well. We also have household transmission studies going on. We were doing that for the flu virus before COVID, and now we're doing it for COVID. And again, this is a study led by Hong McLean with funding from CDC, and we're part of a national network. And we're looking at transmission of the COVID-19 virus in families, and to what degree vaccination can help reduce that. So we are very involved at the national level in terms of assessing both the safety of the vaccine as well as the effectiveness of the vaccine. There's a massive amount of misinformation on the internet. I've seen a lot of it. People send it to me, and I look at it, and they ask me to comment on things. And I've seen videos of people in school board meetings or council meetings, people who claim to be experts, who are saying that the vaccine will kill you, the vaccine will make you infertile, the vaccine will do all sorts of bad things to you. And I urge people to view those claims skeptically, even from people who claim to be experts, if the message they're giving is very inconsistent with what you're hearing from the CDC and the NIH and people who are credible experts on this. And if the messages they're giving are inconsistent with the scientific evidence. And one thing that I recommend people do, is pretty easy to do, is just do a quick fact check. Just Google fact check COVID vaccine and then put in whatever it is you're interested in, infertility or magnetism or toxic ingredients. And there are some very good fact-checking sites out there that will walk you through the evidence and provide valid factual information that then you can use to assess on your own whether or not what you're seeing should be taken seriously or not. Because unfortunately, while I'm happy to sort of respond to people who send me these things, I can't sort of do this for everyone. And so people have to become comfortable sort of doing some of their own fact-checking online when they see claims that seem extreme. I think it's going to be hard to reach herd immunity. There's no magic threshold at which this virus is going to go away. It's not going to go away. It's going to stay with us. But the pandemic will end. And what we need to end the pandemic is to get vaccine coverage up to a high enough level, around 80 to 90% of people, where the virus has become a nuisance. Because the people who are vaccinated will be protected against severe illness from this virus. The virus itself will continue to be out there. It'll continue to cause respiratory disease, but it will not be filling up the ICUs and the morgues with people because of the severity of the illness, because vaccinated people, first of all, will have much more protection than unvaccinated people, and they will be much less likely to develop any kind of severe infection from COVID-19. So the key really to getting out of this crisis is to get to very high vaccine coverage in the population, and eventually to get the data we need to determine if we can vaccinate children safely and with high effectiveness, so that overall, we can sort of get back to a normal life. And there isn't going to be any real complete economic recovery and social recovery until we reach that point. Right now, we're a long way from there.